Assalamualaikum everybody. Today we'll be looking at Escherichia coli. But before getting into the video, I'd like to tell you guys that these videos are meant for educational purposes. Things and treatments may change with time. If I get wrong or miss anything, your input is always welcomed in the comments section. So let's jump straight into the video. But before talking about E. coli, we should know how the bacteria are classified. Bacteria are classified into spirochetes, acid-fast, and there's an exception that is Mycoplasma bacteria. Then bacteria are also classified based on gram staining into gram-positive. We are not concerned here with them because we're done with all the gram-positive bacteria. If you guys want to know more about them, be sure to check out the channel. Let's talk about gram-negative. Gram-negative bacteria are further classified into cocci, like Neisseria, Neisseria gonorrhoeae, and Neisseria meningitidis, and also into rods. And rods are further subdivided into aerobic, like Pseudomonas, anaerobic, like bacteroids, and facultative. Facultative are further subdivided into curved, like Campylobacter, Helicobacter, and Vibrio, and also into straight. And straight are further subdivided into respiratory, like Haemophilus, Bordetella, Legionella, into zoonotic, like Brucella, Francisella, Pastorella, Yersinia, and also into enteric and related. You might be wondering, you've written the word related. I'm going to explain that in just a moment. Like E. coli, Enterobacter, Serratia, Klebsiella, Salmonella, Shigella, and Proteus. Enterobacter and related organisms are like those who are within the enteric tract, like those cause infection inside the enteric tract, those who cause infection outside the enteric tract, and those who cause infection in the both areas, like within the enteric tract and outside the enteric tract. E. coli is the one who causes infection in both areas, and also the Salmonella. Those that just cause infections in enteric tract are Shigella, Vibrio, Campylobacter, and Helicobacter, while the ones that causes infection outside the enteric tract are Klebsiella, Enterobacter, Serratia, Proteus, Providencia, that's its Spanish word, and then Morganella, that's an Italian word, Pseudomonas, Bacteroides, Protella, and Fusobacterium. But that's not all. Gram-negative bacteria are also classified based on the shape into Diplococci, Coccobacilli, rods, and comma-shaped. Diplococci are further classified based on maltose fermentation. If a bacteria ferments maltose, it's maltose fermenter. That's Neisseria meningitidis. And if it doesn't, then that's going to be Neisseria gonorrhoeae. Coccobacilli like Haemophilus influenza, Brucella, Pastorella, Bordetella pertussis. Rods, they're further subdivided based on lactose fermentation. If bacteria ferment lactose, then it is going to be fast or slow fermenter. Fast ones include Klebsiella, E. coli, the topic of today's video, and Enterobacter. And slow ones include Serratia and Citrobacter. And the non-lactose fermenter are further subdivided based on oxidase test. If a bacteria is oxidase positive, that is Pseudomonas. If it's negative, that is Shigella, Salmonella, Proteus, and Yersinia. Comma-shaped bacteria are further classified based on certain criteria. All these three comma-shaped bacteria are oxidase positive. If a bacterium produces urease, it is going to be H. pylori. If a bacterium grows in 42 degrees Celsius temperature, it's Campylobacter jejuni. And if it grows in alkaline media, it's Vibrio cholera. Now let's officially start Escherichia coli. It's gram-negative rod. As you can see there in this picture, gram-negative bacteria stain pink or red on gram staining. So Escherichia coli is kind of red colored in this microscopic picture. It's rod-shaped bacterium, as you can see this rod. It is straight, just like that. It is facultative, which means it can live in the presence and also in the absence of oxygen. It is anaerobe, it is lactose fermenter, and is beta hemolytic. If you guys want to know more about what is beta hemolysis, alpha and gamma, watch my Streptococcus and Staphylococcus bacteria videos. Some strains of Escherichia coli are harmless. You might be wondering, it's a bacteria and supposed to cause disease. Why is it harmless then? Okay. It's the part of normal human colonic or intestinal flora. That's why. But some strains are pathogenic. Escherichia coli is indole positive. It means that it produces indole from tryptophan. It is catalase positive. I do have a short video on what's catalase test. Be sure to check that out. It is responsible for causing these diseases. Diarrhea that can be watery or bloody based on certain strains of E. coli. It causes UTIs, it causes neonatal meningitis or sepsis, and also a complication occurs there, and that is hemolytic uremic syndrome, HUS. Bloody diarrhea caused by 0157H7 strains. Don't worry, we're going to talk about these strains in just a moment. Has a low infectious dose 50 of approximately 100 organisms. E. coli has got 3 antigens. We'll look at them in detail in morphology section. E. coli also secretes certain toxins. It secretes 1 endotoxin and 3 exotoxins that are termed as enterotoxins. 2 are responsible for causing a watery diarrhea, and they are heat labile LT toxin and heat stable ST toxin. And the third one is responsible for causing bloody diarrhea and hemolytic uremic syndrome. Lecture outline, we're done with the introduction of E. coli and also the classification of bacteria, enterobacter and related organisms. Now we'll be looking at the morphology, habitat and transmission of E. coli, then the pathogenesis of the diseases it causes, the clinical findings, lab diagnosis, treatment, prevention, and at the end, as usual, we'll review the lecture. Morphology. E. coli is rod-shaped bacterium, as you can clearly see there in this picture. It is a straight organism. Size, it is 2 micrometers long, and it varies in diameter from 0.25 to 1 micrometer. It's pink color, the reason is it's gram-negative. Structure, it has got a cell wall. It is encapsulated bacterium. It has got a thin peptidoglycan layer. It is not responsible for forming spore. It is motile. The reason is that it has got flagella. As you've seen in the introduction picture, the pink E. coli having the long flagella, right? And the small pili. Let me show you them again. These ones, these long ones are the flagella and these short ones are the pili. Okay. Now it's time to explain the 0157H7 strains of E. coli, right? E. coli has got 3 antigens, as I mentioned earlier. The first one is O, or cell wall antigen. The second one is H, or flagellar antigen. The third one is K, or capsular antigen. Because there are more than 150 O, 50H, and 90K antigens. The various combinations result in more than 1,000 antigenic types of E. coli. Specific serotypes are associated with specific diseases. For example, O55 and O111 cause outbreaks of neonatal diarrhea. This is how Escherichia coli looks like under the microscope. It is rod-shaped bacterium, as you can see there, just like that. It is straight. It has got these short pili. You can see, you might not see flagella there, but I've shown you them in the introduction picture. Habitat, hosts. The reservoir of E. coli includes both humans and the animals. In humans, it's a part of normal colonic flora. Transmission. The source of the E. coli that causes urinary tract infections is patients' own colonic flora that colonizes the urogenital area. Like from colon, it gets into the urogenital area and it colonizes there. So it causes UTIs. The source of E. coli that causes neonatal meningitis is the mother's birth canal. The infection is acquired during birth. In contrast, the E. coli that causes traveler's diarrhea is acquired by ingestion of food or water contaminated with human feces. And the main reservoir of enterohemorrhagic E. coli 0157 is cattle. As I mentioned that animals are also the host of E. coli, so it's the main reservoir of enterohemorrhagic E. coli 0157. And this organism is acquired in undercooked beef and is also acquired via direct contact with animals. For example, visits to farms and petting zoos. Pathogenesis. Prior to talking about the pathogenesis, let me tell you something really cool. There are 4 structural components that help the E. coli cause different diseases. Number 1 is pili. Then we've got capsule. Then we've got 1 endotoxin and 3 exotoxins. Now let's talk about what kind of pathogenesis exists in the infections caused by E. coli. E. coli causes infections within the intestinal tract that are watery non-bloody diarrhea, that's traveler's diarrhea, also the bloody diarrhea caused by E. coli 0157, and hemolytic uremic syndrome caused by enterohemorrhagic strains of E. coli. And it also causes infections outside the intestinal tract, like UTIs, neonatal meningitis, and sepsis. First, let's talk about the intestinal tract infections. The first step is the adherence of the organism, means the E. coli, to the cells of jejunum and ileum by means of pili, the first structural component. And pili protrude from the bacterial surface. Once attached, the bacteria synthesize enterotoxins, the other structural component, the exotoxins that act in the enteric tract, which act on the cells of the jejunum and ileum to cause diarrhea. The toxins are strikingly cell-specific. The cells of the colon are not susceptible, probably because they lack receptors for toxin. Enterotoxigenic strains of E. coli. ET is for enterotoxigenic and EC is for E. coli. Can produce either or both of enterotoxins. The first one is heat labile toxin, the LT, and the second one is heat stable toxin, ST. Let's talk about the heat labile toxin first. It acts by stimulating adenylate cyclase. Its action is similar to the cholera toxin. It acts by catalyzing the addition of adenosine diphosphate ribose, a process called ADP ribosylation, to the G protein that stimulates the cyclase. This irreversibly activates the cyclase, that's the enzyme. The resultant increase in intracellular cyclic adenosine monophosphate concentration. And this concentration does what? It stimulates cyclic AMP-dependent protein kinase, which phosphorylates ion transporters in the membrane. Then what happens? The transporters export ions, which cause an outpouring of fluid, potassium and chloride from the enterocytes into the lumen of the gut, resulting in what? Resulting in a watery diarrhea. This is how watery diarrhea is caused. We'll talk a little more about watery diarrhea in just a moment. Now let's talk about the heat stable toxin, the ST. This is the enterotoxin, and that's the low molecular weight toxin, and it stimulates guanylate cyclase. Let's talk about watery diarrhea once more. The enterotoxin producing strains do not cause inflammation, and they do not invade the intestinal mucosa, but they cause a watery, non-bloody diarrhea. Now let's talk about the bloody diarrhea. Certain strains of E. coli are enteropathic, means enteroinvasive, and they cause disease not by enterotoxin formation but by invasion of epithelium of large intestine. That causes the bloody diarrhea, that's dysentery, and that's accompanied by inflammatory cells, the neutrophils in feces. Certain enterohemorrhagic strains of E. coli, i.e. those with O157H7 serotype, also cause bloody diarrhea by producing an exotoxin called Shiga toxin. You might be wondering, we're talking about E. coli, not Shigella. Why is it then called Shiga toxin? Alright, let me tell you. It's called Shiga toxin because it is very similar to one produced by Shigella. What does Shiga toxin do? It acts by removing an adenine from the large 28S ribosomal RNA, thereby stopping protein synthesis. Shiga toxin is encoded by temperate lysogenic bacteriophages. Shiga toxin is also called verotoxin because it has a cytopathic effect on Vero cells, monkey cells, in culture. Now let's talk about hemolytic uremic syndrome, HUS. Some patients with bloody diarrhea caused by O157H7 strains also have a life-threatening complication. That is this, HUS, which occurs when Shiga toxin enters the bloodstream. This syndrome has this triad. It is characterized by this triad that consists of hemolytic anemia, thrombocytopenia, and acute renal failure. Let's talk about these three one by one. Hemolytic anemia. It occurs because there are receptors for Shiga toxin on the surface of endothelium of small blood vessels, the capillaries. Death of endothelial cells of small blood vessels occurs. Why? The reason is that when red blood cells passes through the damaged area, they become grossly distorted and are termed as schistocytes, and then they are lysed. And this condition is called microangiopathic hemolytic anemia because there is destruction of red blood cells. Now let's talk about thrombocytopenia, that's a low platelet count. Thrombocytopenia occurs because platelets adhere to damaged endothelial surface. That leads to a low platelets count in blood, and this is called thrombocytopenia. The third one is acute renal failure. It occurs because there are receptors for Shiga toxin on the surface of kidney epithelium. Death of kidney epithelial cells leads to renal failure. Prior to going further, let me tell you one thing. The treatment of diarrhea caused by O157H7 strains with antibiotics, such as ciprofloxacin, increases the risk of developing HUS, hemolytic uremic syndrome. Why? Because the amount of sugar toxin is increased. The reason is that the dying bacteria are releasing sugar toxin. Now let's talk about urinary tract infections. They occur primarily in females, and the reasons are that they've got a short urethra and the proximity of urethra to the anus. Proximity means urethra is close to anus. And the third one is colonization of vagina by the members of fecal flora. Certain O serotypes of E. coli preferentially cause urinary tract infections. The strains of E. coli that are responsible for causing UTIs are uropathic strains. The uropathic strains are characterized by pili, the structural component, if you remember, with adhesin proteins. They bind to specific receptors on urinary tract epithelium. The binding site on these receptors consists of dimers of galactose, gall dimers. These pili that are causing the infection are also called P. fimbria and pyelonephritis associated pili, PAP. Let me tell you one really cool thing about cranberry juice. This is the cranberry plant and these are its juices. Cranberry juice contains flavonoids that inhibit the binding of pili to the receptors and may be useful in prevention of recurrent UTIs. Time to talk about these systemic infections. The other two structural components are going to come into play in systemic infection. First, let's talk about the capsular polysaccharide. That interferes with the phagocytosis, thereby enhances the organisms, means the E. coli ability to cause infection in various organs. For example, E. coli strains that cause neonatal meningitis usually have a specific capsular type called the K1 antigen. The endotoxin of E. coli is the cell wall lipopolysaccharide, which causes several features of gram-negative sepsis such as fever, hypotension, and disseminated intravascular coagulation, DIC. We are done with the pathogenesis. Now let's talk about the clinical findings. E. coli causes a variety of diseases both within and outside the intestinal tract. Let's talk about their clinical findings. First, we are going to look at the ones that are within the intestinal tract. The first one within the intestinal tract is ETEC diarrhea, that is enterotoxigenic E. coli diarrhea. That's usually watery, non-bloody, self-limiting, and is of short duration, ranging from 1 to 3 days, and is frequently associated with travel, the traveler's diarrhea or turista. The second one is EHEC diarrhea, the enterohemorrhagic E. coli diarrhea. It results in a dysentery-like syndrome that is characterized by bloody diarrhea, abdominal cramping, fever similar to that caused by Shigella. And the third one is STEC diarrhea. ST is for O157H7 strains and EC is for E. coli. So these strains of E. coli, they cause bloody diarrhea, which can be complicated by hemolytic uremic syndrome. And this syndrome, as I mentioned in pathogenesis, is characterized by kidney failure, hemolytic anemia, and thrombocytopenia. Now we're going to look at the clinical findings of the infections that are caused outside the intestinal tract. The first one is UTIs. The community-acquired UTIs occur mainly in females, while the hospital-acquired or nosocomial UTIs occur in both males and females. Urinary tract infections can be limited to bladder or extend up to the collecting system to the kidney. If only the bladder is involved, the disease is called cystitis, whereas infection of kidney is called pyelonephritis. The most prominent symptoms of cystitis are pain, dysuria, and frequency of urination. Patients are usually afebrile. Pyelonephritis is characterized by fever, flank pain, costovertebral angle tenderness, dysuria, and frequency may or may not occur. E. coli is also a major cause, along with group B streptococci, of meningitis and sepsis in neonates. Exposure of the newborn to E. coli and group B streptococci occurs during birth, as a result of colonization of vagina by these organisms. E. coli is the organism that is isolated most frequently from patients with hospital-acquired sepsis, which arises primarily from urinary, biliary, or peritoneal infections. Peritonitis is usually a mixed infection caused by E. coli or other facultative enteric gram-negative rods, plus anaerobic members of colonic flora such as bacteroids and fusobacterium. Now let's talk about the clinical findings with the pathogenesis behind them and their main lab results. Findings within intestinal tract. The first one is watery non-bloody diarrhea, the traveler's diarrhea. The pathogenic finding behind it is the enterotoxin that increases cyclic EMP. And there are no red blood cells or white blood cells observed in stool or feces. The second one is bloody diarrhea that's caused by E. coli 0157 strain and hemolytic uremic syndrome. The pathogenic finding behind them is sugar toxin, the verotoxin that inhibits the protein synthesis, and we'll find red blood cells in stool and schistocytes in blood smear. Findings outside of intestinal tract. The urinary tract infections. The pathogenic finding behind it is the goggle pili binds to bladder mucosa. White blood cell is found and there's a positive urine culture. Neonatal meningitis. The pathogenic finding behind is the K1 capsular polysaccharide that is antiphagocytic. White blood cell is found in spinal fluid and there's positive CSF culture. Sepsis. Endotoxin includes fever, hypertension, and DIC, disseminated intravascular coagulation. And the lab results are leukocytosis, positive blood culture. Complication. The infections caused by E. coli can complicate to chronic diarrhea, IBS, inflammatory bowel syndrome, hemolytic uremic syndrome, end-stage renal disease or stroke like hypertension, proteinuria, and low GFR. Lab diagnosis. Samples. We'll need blood, urine, feces, and spinal fluid. Microscopy. On blood smear, we'll find distorted, fragmented red blood cells called schistocytes. On gram staining, this bacterium appears to be gram-negative because it's pink-colored. It's rod-shaped, straight bacterium. Size. It's 2 micrometer long and varies in diameter from 0.25 to 1 micrometer. It's pink-colored. This is how it looks like under the microscope. Rod-shaped bacterium with pili and it's straight. Culture. We'll use stool sample for culturing. This is E. coli colonies on McConnachie agar. They are circular and pink colored because they ferment lactose. If E. coli is not responsible for fermenting lactose, its colonies will be colorless, but it's actually responsible for fermenting, so that's why it's pink. E. coli is grown initially on blood agar plates and on a differential medium, such as EMB, eosine methylene blue, agar or McConnachie's agar. E. coli, which ferments lactose, form pink colonies, whereas lactose-negative organisms are colorless. On EMB agar, E. coli colonies have a characteristic green sheen, and this green sheen is for lactose fermenters. Other tests that we can perform for E. coli identification are blood tests. We'll go for CBC, we might find leukocytosis. We'll go for blood culture and also blood smear. We'll go for urine tests like urine routine examination, urine culture and its smear. Stool test, its examination and smear. Spinal fluid tests like CSF culture or smear. Treatment. Treatment of E. coli infections depends on the site of disease and resistant pattern of specific isolate. Certain medicines are prescribed like rifaximin, azithromycin, fluoroquinolones like ciprofloxacin, trimethoprim sulfamethoxazole, nitrofurantoin, ceftriaxone, ampicillin, loperamide. We'll also go for certain measures like rehydration because there's a watery diarrhea. We'll give oral fluids or IV fluids. We'll go for dialysis in case of renal failure and stuff. We'll also go for transfusions in case of anemia and thrombocytopenia if they are severe. Prevention. Proper hygiene because it is caused by contamination of food or water with human feces. Prompt removal of catheters. Use of cranberry juice, I've explained that. Prompt removal or switching of intravenous line if they're causing the infection. Avoid eating uncooked food and unpurified water. Alright guys, let's review everything really quick. The organism we discussed today is E. coli. It's responsible for causing UTIs, diarrhea that can be bloody or watery, neonatal meningitis, sepsis, and HUS, hemolytic uremic syndrome. It is transmitted when the colonic flora colonizes urogenital area, during birth, ingestion of food or water contaminated with human feces, and also the contact with animals. Its hosts are humans. It's the part of normal colonic flora of humans, and also its hosts are animals. Its diagnosis is based on gram staining, microscopy, culture, blood, urine, stool examination. It is treated with certain medicines like trimethoprim sulfamethoxazole, nitrofurantoin, rifaximin, azithromycin, and loperamide. And There are certain measures that are taken to treat the E. coli infections. There are rehydration, dialysis, and transfusions. And that's it for today's video. I hope you guys enjoyed it. You've learned something. If you really did, give this video a big thumbs up. Comment down below in the comment section. And if you want to connect with me on my socials, I've got my Instagram, Twitter, and I'll catch you in the next video. Till then, Assalamualaikum.